Hi, I'm Dr. Melanie Palm. I'm a board-certified dermatologist in San Diego, California, and I'm medical director of Art of Skin MD. And in this section, I want to talk a little bit about patient assessment. I think for any patient that you're bringing in for a cosmetic consultation, especially if you're talking about structures of the face, we really want to do a good facial assessment. I think this is really insightful for patients. It's helpful for you. I think developing a guide and sort of a logarithm you can use helps you really analyze a face. I think after a while it becomes sort of hardwired, but I really want to share an opportunity of sort of how I see faces and how I analyze faces, especially in preparation for injectable procedures such as Sculptra aesthetic. So we have a beautiful patient here today. Julie is 40 years old. She's actually had Sculptra, but it's been a while ago. She had Sculptra aesthetic last about a year ago. But she's very active, she's athletic, and so we do see sort of changes in the face, not only related to natural processes of aging, but also due to the activity level that she has as sort of a baseline in her life. So I'm going to have Julie just look straight ahead. And I think the first thing to do, whether you're looking at a female or male patient, and we'll have the opportunity to talk a little bit about the male face later on, is that you want to look at just gestalt, overall facial shape. And in general, and this is universally, regardless of what ethnicity we are, a female face is typically oval-shaped to heart-shaped. And so we see that with Julie. You know, she does have a pretty and strong jawline, and so something we want to watch over time is squaring of that jaw. But overall, she has an oval shape to her face, which is classically feminine. The other thing that I do, and you can do this when you're actually doing the consultation, is really watch the patient with animation. So I like to have the patient smile for me, big open mouth smile, and then also frown for me if you can. Good. And I think we'll go on and we'll do that some more, but I think that's great to do not only while you're doing the consultation, just getting to know your patient, but I think that's actually good to do when you're actually looking critically at facial analysis. You can see how muscle is interfacing with soft tissue, where there's good bony support, and where you just might need to help circumvent changes that are happening at various tissue levels. So after I've taken an overall look at facial shape, I've also looked a little bit at animation. Then the next thing I'll do in a female face is to actually look at facial thirds and facial fifths. So we'll actually look at facial fifths first. So there's a fixed width in all of us, and it's called our intercanthal distance, and it's that distance between our two medial canthi. This is fixed throughout our life, and it, if you do quite a bit of reading in sort of our beauty literature and facial analysis literature, it really corresponds to beautiful proportions in the face. And so typically on most faces, if you take that intercanthal distance, you can march that into 5 columns of width across the face. So there's a central width right here, then the eye width here is a second fifth. There's a third fifth going from the lateral canthus to the hairline, and then that's repeated on the other side of the face. That fourth fifth is right here, and there's one here. And something we see almost as a constant in patients as they age and as they change through maturity is this lateral fifth on this side as well as this side starts to lose volume. So we often will see support loss in the temple, and this also affects the periocular region. There's also a very large superficial fat pad that sits in the lateral portion of the face. It's sometimes called the lateral fat pad or preauricular fat pad or temporal cheek fat pad. Regardless of what you call this, this really is an area of support that we need to have in order to give proper three-dimensional volume restoration of the face. And in particular, this area of the lateral face, I'll have you turn to the left. As we lose volume here, that's particularly important in our post-facelift patients. This is an area that tends to lose volume. And as we lose fat volume here, it can also play a role in sort of our junction between our jawline and our neck. So in addition to that, once we're sort of done looking at facial fifths, then I typically march down the face superior to inferiorly. And so there's classically 3 facial thirds that we talk about. The upper third of the face that starts from the hairline and ends right at sort of the orbital rim, or you can call it the eyebrow for most patients. From the radix or the root of the nose to the base of the nose. This is what we consider the midface. And then the lower third of our face, which starts right at the base of our nose and ends at our chin. And so I will kind of progress superior to inferiorly when I'm looking at a patient, looking at those facial thirds. Now, if we look at Julie, and you can kind of gestalt this or make a little sort of template for yourself, she's actually doing quite well with her facial thirds. I mean, that's why she's such a pretty woman. So generally speaking, there's not a huge difference between some of those facial thirds in terms of overall distance or width of those. You may run into some women, if their forehead is too large, they wear bangs. So sometimes some of us will also ask about hairstyling, because everyone has a natural eye for beauty, and we often compensate if something is a little bit out of kilter on our own face to adjust for that. Now, when I look at Julie's upper third of the face, and I'm going to have you turn to the side again, women have a very characteristic feature of their forehead. We should have a central sort of convexity, a nice sweeping outward change that's about 11 degrees on a female patient. And as we see in most patients that are athletic or just with aging changes, we start to lose some of that central fullness in our forehead. So that would be an area that I would kind of analyze and pay attention to. I'm going to have you come forward again. And the last area that I look at in the upper third of the face is this area of the glabellar complex. And in general, there should be some really pretty, and I think Julie has a good example of this, sort of light reflex that almost looks like a gull wing in this region. So she's preserved this. We'll have you frown for me, Julie. There's not a lot of movement. This is an area that's indicated for a neurotoxin. At this point, I wouldn't treat her, but at some point in the future, we probably would use that. And then I like to look at brow position. So in a female patient, typically our medial brow is a little bit lower, and then it peaks subtly about 2/3 the width up here. It should be about 8 millimeters to 10 millimeters above the orbital rim. And then it should slightly slope downwards, and it should end kind of in a diagonal from the lateral canthus if you sort of bring that at a 45-degree upwards. So she's actually in a good position there. Her left eyebrow does sit a little bit lower. This is her driving side. It's often a side here in the United States where we drive on the right side of the road that we notice a little bit more volume loss. So this would be an area that I may need to support a little bit better with efforts in order to rejuvenate her face. From that, we're going to actually move on to the midface. And so with the midface, this is a really important structure. There are both bony changes as well as soft tissue changes that happen in the face over time. We know that the orbital rim, it tends to widen over time, almost like a lemon. We start to lose volume up here as well as down in sort of the inferior lateral portion of the orbital rim. So it kind of widens over time. The nasal bone or aperture also widens over time, and the nasal tip tends to descend downwards. We start to see more bony remodeling and volume loss in this area. So those are really bony features that I'm looking for in a patient. As we start to think beyond bone and the soft tissue that's sitting above it, there's two sets of fat compartments that comprise support within the midface. Deeply, there's a deep medial cheek fat pad. There's the SOOF that's actually underneath the orbital rim and helps to support the periocular region. And then there's a portion of the buccal cheek fat pad, which you can see a little bit, and Julie has actually lost some volume. And so these would be areas that I would want to help, as we start to lose some of that deep support, and as some of the superficial fat compartments, so the nasolabial fat pad, which I can start to see a little bit of shifting inferiorly here. Our medial superficial cheek fat pad, our middle cheek fat pad, and then that big lateral one that we talked about with our facial fifth. They all can start to lose a little volume, and we start to see lines of demarcation. In youthfulness, we have these beautiful convexities and contours that are continuous, but with aging changes and as we start to lose volume and support, whether it's bony support or some of the overlying fat, we start to notice transition zones along sort of cosmetic compartments. So, for for example, on Julie, we can just start to see a difference between the infraorbital region as well as sort of the cheek region and demarcation. When I'm looking at the midface, I do often have the patient smile really big for me. And Julie's holding on quite well, but sometimes there's a little bit of a step off from where we see that supportive deep medial cheek fat pad and then some of this lateral support. So sometimes that's an area that I like to support when we're rejuvenating the face. And then I think it's really important to look at the nose. You know, our eyes and our nose are where we gravitate first when we're looking at an individual. So Julie has a beautiful nose. If you look at that intercanthal distance, the width of her nose should be about that same width, and the majority of her lip volume should be there, and the width of her chin should be there as well. And she's holding those nicely. There should be light reflex on the nasal tip. There's classically 4 points of nasal light reflection in that area. A female patient's nose, typically a nice either sort of if you'll turn to the side for me, either just a straight line or a slightly downward slope is actually natural on a female face. And oftentimes there's a little break at the super tip area, and we like that. And then come back. But some patients over time tend to lose a little bit of volume and support. So those are areas that I'd like to identify as well. And that really kind of concludes mid-face. So lastly, I really want to talk about the lower third of the face. In women, you know, we don't have terminal hairs. We don't have a beard area. And so this is an area that tends to age a little bit faster. There are bony changes and soft tissue changes that happen on the face over time that really can aggressively age the lower face. So this is an area that I spend a lot of time with some of my female patients on. Looking at Julie, if you'll turn to the side again for me, she's got a really beautiful jawline. But this is an angle that changes over time. The ramus of her mandible and the arm of it loses that acute angle over time. So that's an area that we want to make sure that we're analyzing and supporting, if appropriate, to keep that really pretty sort of angle to support the lower portion of the face and even support around the neck. If you look straight ahead for me, a telltale sign that we're losing volume in that area is if you start to lose communication as you're looking back between the jawline and you can't see where it connects the ear. And I can pull on the ear and there's a little bit of volume loss back here. So that to me indicates she's probably lost a little bit of soft tissue support, may have some early bony remodeling occurring there. Julie's got really nice support to what we call the piriform aperture, or this area just right next to the nasal ala. But as our nasal aperture widens over time, this is an area that can lose volume. Rhisto space, which is right underneath the deep medial cheek fat pad, is an area that sometimes will help with restoration efforts. She does have a little bit of a nasolabial fold. I tell patients it's really normal to have a nasolabial fold. We often subtly help that a little bit just so there's soft transitions, but it's very unnatural to completely fill this. Patients can get a simian or monkey-like look if this is overfilled. There are ratios in the lower third of the face. So typically from the base of the nose to the opening of our mouth, we want this to be about a 1/3 ratio to 2/3 in the lower portion of this lower third of the face. And what happens over time is our upper lip, or our ergotrid, tends to elongate, and this ratio of 1/3 to 2/3 becomes closer to 1 to 1. And that hasn't really happened too much in Julie, but she has lost some volume in what we call the marionette area, or this sort of pre-jowl sulcus. So this is an area that I would love to support. It would be appropriate to help any wrinkles and contour deficiencies with Sculptra aesthetic in this region. So lastly, we'll talk about the lips and we'll talk about the chin. In female chins, it's actually okay, and I'm going to have you turn to the side again for me, Julie. For a chin, if we drop a vertical from the base of the nose downwards, for the chin to actually lie right on that line or a little bit behind it. Men should be on the line or actually in front of it. She's actually got a pretty darn good chin, but there is a little bit of resting tone. You can notice a peau d'orange change just subtly in this area. Julie does have volume loss in this area, just lateral to the chin. So this is an area that we'd want to support. It also helps to relax some of the muscular movement. If you'll show me your lower teeth, you can actually see her DAO and DLI moving quite a bit when she animates with us. So that's why, again, I think it's important to watch patients just when you're talking to them during cosmetic consultation to help get an idea of their animation and where they may have volume deficiencies at animation, because it's important that not only are we restoring patients when we're sitting here at rest, but that we're also making our patients look natural when they're in real life doing real life animation. And then finally, the lips. So I talked a little bit about that. The majority of lip volume should happen in sort of the middle half to middle third of the lip. In a Caucasian woman, the upper lip should be a little bit smaller than the lower lip. Now, there are ethnic differences. Hispanic patients and African American patients, this ratio of upper lip to lower lip can be closer to 1-to-1, and it looks very beautiful and fitting on the patient. But these are also ratios that sort of stay in line with this lower third of the face, and I think are important to pay attention to, especially with sort of natural lip augmentation. So today with Julie, we're going to do a little bit of Sculptra aesthetic in areas of support where she's noticed some facial wrinkles. These include the buccal area, or sort of radial lateral cheek area. We'll treat a little bit of the lateral cheek in this area. I want to give her support in this area deemed the pre-jaw sulcus or marionette area. She's got a little bit of a nasolabial fold. We'll put a little bit of the Sculptra aesthetic in the upper portion of the nasolabial fold and softly contour down. Now, not at this treatment visit, but other areas that we can enhance with other products within the Galderma portfolio. It would be nice in the future to address some of the cheek volume loss that's occurred just slightly on Julie. So being able to use Restylane Lift in the mid-face to address some of her cheek concerns, especially in the lateral area where we tend to get a step off over time. All of us age in our lip region, and as we start to age, we start to get a little bit of fine volume loss and some changes in the lip architecture, and being able to support that with Restylane Silk would be a nice addition, I think, to rejuvenating her face. And then obviously not today, but if she did have a time in which her glabellar rhytids did reappear, it would be lovely to use a neurotoxin such as Dysport, abobotulinum toxin A in that region. So that really finishes the assessment for our patient, and today we're going to move on to product preparation, proper preparation of the skin for treatment, and then treatment injection with Sculptra aesthetic.